Hello, everyone. My name is Bill Mckendree. I'm the Executive Director of the Pennsylvania Healthcare Benefits Solutions Program, PHBSP. We help people navigate through the complexities of programs like Medicare and Medicaid and the private health insurance marketplaces. We provide individual counseling and patient advocacy services, and we produce community education presentations like the one you're watching now. This presentation was recorded in March 2023, and the topic is entering the Medicare system. I hope you enjoy it. Hi, everyone. This is Bill Mckendree, and we're going to be talking about the initial steps in entering the Medicare system. Often the most important and the most challenging decisions regarding the utilization of the Medicare system occur when individuals first become eligible to enter Medicare. Once upon a time, in Medicare's early years, the process of entering the Medicare system was pretty straightforward and relatively simple. You turn 65, and likely at that point, you were no longer working or just on the cusp of not working. And you enrolled in the basic components of Medicare, the government's portion, Part A and Part B. And that was the representation of Medicare. And usually you did it at exactly the same time you started your Social Security benefits. You went to a local Social Security office, you sat down with one of their representatives, you said, now that I'm turning 65, I want to start my Social Security retirement benefits, and I want to enroll in Medicare. And about 30 minutes later, it was done. And that was the extent of the process. You had your Social Security benefits, you were enrolled in Medicare, and it was anticipated that the government portion of Medicare, the Part A and the Part B, would be sufficient. And certainly some people entering Medicare back then enhanced their basic Medicare parts, their Part A and Part B, with private insurance supplements. But that was not an absolute presumption. And in fact, it was a minority of individuals that utilized private insurance along with a basic Medicare A and B. Most people in the first years of Medicare simply relied on Part A and Part B, and that was presumed to be and effectively was sufficient for their coverage. Two things changed over the past decades that have significantly altered our approach to dealing with Medicare, and certainly our approach in the process of entering Medicare. First of all, people are entering Medicare at a later age because people are working past 65 more and more than they did decades ago. And as a result, they're at least considering postponing entering Medicare till they stop working, whenever that is, and relying instead, while they're working, on the coverage that's provided by the employer. The other thing that has significantly changed the process of going into Medicare is the growing reliance on private insurance products as an essential component of Medicare coverage, as well as the overwhelming volume and complexity of these private benefits. In any given geographic area in America, you're likely able to access at least dozens, if not hundreds, of private insurance products to enhance, supplement, or even replace the basic Medicare Part A and Part B components. And each of these is slightly or greatly different from the others. And this This is not surprising then that people that are contemplating entering Medicare are overwhelmed by just the deluge of options and the decisions they make regarding these, which has made the process complex and confusing and frustrating. Thus, the second part of the title of today's presentation. Maybe once upon a time, it was relatively simple and easy to navigate. It's not that way anymore. So we're going to examine the process of transitioning into Medicare now. We're going to look at the mechanics of enrollment, and we'll also look at the various options that are available to individuals as they contemplate the Medicare system, and how to evaluate those options to achieve what is ultimately the best result of healthcare coverage for themselves, or if they're representing individuals for their clients. Now, before I leave this first slide, let me mention there is my email address and the program's phone number. The best way to get in touch with me is to use the email address. I'll usually get back to you within 24 hours, probably even shorter than that. And the phone number, certainly, but usually it takes me a day or two to take off the messages and usually respond to them. So we're going to start with Medicare's basic characteristics. Just a quick thumbnail of what the Medicare system looks like. Medicare is a federal program. It was created about 60 years ago to provide a basic platform of healthcare coverage for individuals that are eligible. Currently, it's administered by a federal agency called the Centers for Medicare and Medicaid Services, abbreviated to CMS, which is under the Department of Health and Human Services of the federal government. Although CMS administers and regulates Medicare and also Medicaid, the initial connection that individuals are going to have with the Medicare system is through either the Social Security Administration or the Railroad Retirement Board. Depends on which retirement system you worked under. Most Americans work under the Social Security Administration. Some individuals work under Railroad Retirement. In either case, that is the entity that you are going to reach out to initially, or will reach out to you initially, to place you in the Medicare system. Medicare is a fee-for-service program. That means when you go to a healthcare provider that accepts Medicare assignments, that agrees to work with Medicare in serving their patients, they understand, the providers, that they are going to directly bill Medicare to be reimbursed for the services they provide. And they understand that they're going to be reimbursed at a specific amount based on how they identify those services. The beneficiaries under Medicare can go to any provider who has agreed to accept Medicare assignments. And for all intents and purposes, that's essentially every provider, every doctor, every hospital, every clinic in America. Medicare is a national healthcare system. There's some exceptions. You'd have to look really hard to find them. And in any given year, more than 95% of all the healthcare providers in America accept Medicare assignments. But another inherent characteristic of Medicare is Medicare never has been a comprehensive coverage system. It has never paid the entire cost of services under the Medicare umbrella. Some of them are, but most of them aren't. Most of them have cost sharing, that the beneficiary has an obligation to pay a deductible before the parts of Medicare kick in, and even after the parts of Medicare kick in, a cost sharing of either a copayment, a specific dollar amount, or co-insurance, a percentage of the cost of the service. And the providers understand this. They know that they're going to get a portion of their compensation from the Medicare system, and very likely they're going to get a portion of their compensation from the patient if the patient is using Medicare Part A and Part B as their primary coverage. Eligibility to enter Medicare is very basic. If you are a U.S. citizen or permanent legal resident of the United States, once you turn 65 years of age, you're eligible. Individuals that are 65 years or older represent the largest portion of people in the Medicare system. But about 25% in any given year of the people in Medicare are there under age 65. Now, that was not the original intent. Originally, the only people that would be eligible were people that aged into Medicare at age 65. But over time, the eligibility was expanded to incorporate individuals that were recognized by the Social Security Administration or the Railroad Retirement System as disabled. And in most cases, those individuals, once they're recognized as disabled, have a 24-month wait time from the time they start receiving those disability benefits until they're eligible. One exception that was carved out of that is individuals that are disabled and their disability is amyotrophic lateral sclerosis, better known as Lou Gehrig's disease. Those individuals do not have the 24-month wait. There is an accelerated entry once they've demonstrated the disability, and the disability is Lou Gehrig's disease. There's a third category, individuals that are under 65, not necessarily disabled, but are recognized as end-stage renal. They've demonstrated to the Social Security Administration that they are at the final stage or about to be in the final stage of their kidneys shutting down. And as a result, they're in need of or anticipating kidney dialysis and or a kidney transplant. In any of those circumstances, the expectation is individuals, upon reaching that eligibility criteria, can enroll in both the basic components of Medicare, the Part A and the Part B. And that's the other inherent characteristic. Medicare is made up of multiple parts. I mentioned two of them already, the government's portion of Medicare, the Part A and Part B, but there's the other things that have evolved over the past 60 years to represent the completeness of the Medicare system and Medicare coverage. It's this patchwork of various benefits covering specific things that makes Medicare so complex to wrap one's head around, and so difficult for individuals entering the Medicare system that don't have a familiarity with Medicare, never thought about it up to a certain point, that now have to become aware and ideally adept at understanding and navigating through the process. So the platform that all individuals will anticipate initially picking up is the government's portion, Part A, which covers a significant part, though not all, of the cost related to being inpatient. And Part B, that part of the government's coverage of Medicare, that covers a significant part, again, not all, but a significant part of the cost related to outpatient services. This is what Medicare was when it was created. This is what Medicare for a while represented as the exclusive coverage that the majority of individuals relied upon. And as a result, it's often referred to as the traditional Medicare system or the original Medicare. I like to refer to it as basic Medicare, the platform that you attain initially upon which you build with the other products. And there are certain things Medicare doesn't cover. It's a legacy. Traditionally, they haven't. It's not likely they will, at least in the foreseeable future. Medicare, Part A and Part B of the system, do not cover the costs associated with routine eye care or the costs associated with routine dental care or the cost associated with obtaining hearing aids and the exams and process for determining and fitting those hearing aids. And the Medicare system does not cover the cost associated with what is deemed to be long-term care. That's an arbitrary term, but it has a significant impact. And basically, it means once an individual has been in the inpatient system for a period of time and transitioning into what is called skilled nursing, rehabilitative care, Medicare covers a certain number of days within that system. And once that extent has been reached, Medicare and the private insurance products within the Medicare system no longer cover the cost associated with the institutional care or the home-based care that is now recognized as personal care or long-term care as opposed to medical care. And even services that are recognized under the umbrella of Medicare may not be covered under certain circumstances in certain situations if Medicare deems that particular service to be unnecessary in that particular instance. So when an individual reaches their eligibility criteria, they're going to start the process of anticipating, are they? And if they are, how are they going to exercise and execute the entry into Medicare? Now, it can happen one of two ways. It can be done automatically without the individual having to take any steps, or it may require that the individual has to affirmatively reach out to the Social Security Administration or Railroad Retirement System to start the application process. Individuals that are automatically enrolled in Medicare are individuals that are already receiving some form of Social Security or Railroad Retirement benefit at the time they become eligible to go into Medicare. So, for example, if an individual has been recognized as disabled by the Social Security Administration and they're already receiving Social Security disability benefits, when that period of wait time, whether it's a 24-month period or a 0 wait period, they're diagnosed with ALS, then the Social Security Administration will reach out to that individual, usually a few months before the eligibility anniversary, to inform them that they're being enrolled in the basic platform of Medicare, Medicare Part A and Part B. That also could be the case for individuals that started their retirement benefits prior to 65. It's possible. Many individuals start receiving their Social Security retirements at age 62 or 63 or 64. Point is, before 65. So that they're already receiving their Social Security retirement benefits within a couple or 3 months before they're eligible to enter Medicare based on their age 65. They'll receive the initial enrollment package from the Social Security Administration. And this package is going to tell them that they're being enrolled in Medicare, when it's going to happen, and it's going to tell them that if they don't want to enroll, they can pass on at least one of the components, Part B. But it's also going to inform them that because they're already receiving some form of Social Security or Railroad Retirement benefit, they're compelled to take the Part A portion of Medicare. And if they accept both Part A and Part B, they don't have to do anything. It will naturally and immediately, or at least within the next month or so, occur. And their card, their Medicare card that's included in this package, will represent a manifestation that they have Medicare A and B, and the date the Part A and Part B are going into effect. The information will tell them that if they don't want the Part B portion of Medicare, then they have to affirmatively reach out to the Social Security Administration and inform them that they do not want to be enrolled in Part B, and they have to do it within a reasonable time before the enrollment takes place, or it'll be presumed that they do want Part B and they'll be in Part B. They can disenroll from that portion, but it's going to take a while, and they'll be responsible for the cost of being enrolled in Medicare Part B as long as that occurs. Now, individuals that are not receiving Social Security benefits by the point that they reach eligibility, or railroad retirement benefits by the point that they reach eligibility, they have the affirmative requirement of reaching out on their own to the requisite agency that's going to enroll them. They have a 7-month period, 3 months before the age of 65, 3 months after the age of 65, and the month they turn 65. Typically, this is going to be based on entering Medicare based on age, because if the individual is entering based on disability, it's likely it's because they're receiving their Social Security benefits already, and thus we're back to the automatic enrollment. So this is really an age-based more exclusively than anything else. And this 7-month period is referred to as their initial enrollment period. Now, this is a schematic to show how the 7 months unfold and what the impact of enrolling in the Medicare system based on the month you choose in that 7-month period. So in pink, you see the first 3 months of the 7-month cycle, the 3 months leading up to your birth month. And in blue are the 3 months after your birth month. And obviously in the middle is the month you turn 65. Now, let's say that I'm going to turn 65 next April. So in April 2024, I'm anticipating that if I want to enter Medicare, and let's also say I'm not receiving Social Security benefits at the time, then I have an affirmative requirement to reach out to the Social Security Administration. If I reach out to the Social Security Administration in the 3 months prior to my birth month, in this case, it would be January, February, and March, the 3 pink months in the chart, then I have an expectation that if I successfully complete my application with the Social Security Administration, I will be enrolled in Medicare, Part A and Part B, because I want to, in this scenario, fully enter in the system. And it'll be in effect by the first day of April, my birth month. Now, there's an exception. If my birthday was the first day of the month, April 1st, then my initial month would be 1 month earlier. It wouldn't be April, it would be March. So instead of January, February, March, it would be December, January, February would be my 3 leading up to months. But my birthday in this example happens to be April 15th. So my expectation, if I want to enter Medicare as early as possible, based on turning 65, it's going to be April 1st. And I have an obligation to reach out to the Social Security Administration at some point in the months of January, February, or March, if I expect my Medicare to be in effect as early as possible. April 1st. Now, if I wait in this example till some day in April, the first or the last or in between, then I'm not going to go in to Medicare in that month. Even if I reach out before my birthday, even if I reach out April 2nd or 3rd, it doesn't matter. And it's not because they're not administratively geared to get me in. It's simply a rule of understanding that if you delay the process till after the initial 3 months, there's going to be a delay in your expectation of entry. So in the case of waiting till my birth month itself, I'm going to go in the first day of the following month. In that specific case, it's going to be the first day of May. Now, I still have 3 more months that represent my initial enrollment period. In this case, the month of May, the month of June, and the month of July. If for whatever reason, I postpone reaching out to the Social Security Administration till the month of May, the 5th month in this cycle, the first month in the blue column, my expectation is going into Medicare the first day of the following month. So in this example, it would be June 1st. And if I wait till June, any of the days in the month of June, it would be the first day of the following month after that, July. And if finally I wait till someday in the month of July, my expectation is going in the first day of that following month, August. Now, I may have a strategic reason for delaying, and thus understanding that if I postpone till the last 4 months in this cycle, I can postpone the process. And for some individuals, that's intended. For other individuals, for whatever reason, it's taken them a while to realize this is what they have to do and this is how they do it. And generally, Medicare is not going to go back in time and assign enrollment if we're after the first 3 months or any of the 4 following months, that it's always going to be a forward enrollment process. An exception to that would be if I reached out to Medicare through the Social Security Administration, and I did that within a reasonable time and followed through the normal process, and there was a delay based on something that happened on the part of the enrolling entity, the Social Security Administration or Railroad Retirement, that I did what I was supposed to do within a timely fashion. Then Centers for Medicare and Medicaid Service will authorize a retro enrollment, even though the Social Security Administration is still working on my application. If I submitted it correctly, completely in the first 3 months, in this case, January, February, or March, I did what I was supposed to do. And for various reasons, they haven't gotten around to completing it, or there's some administrative glitch that's going to require a bit more effort to get it done. When finally the glitch is resolved, when finally I'm enrolled, I have an expectation that the Medicare will be retroactively applied based on the month that I applied. If it was in the first 3 months of this cycle, I'll be recognized as enrolled in Medicare on the first day of my birth month. And if I waited to one of the later months and there was still an administrative glitch, I'll at least know that I can be retroactively posted back to the month I'm supposed to be enrolled. There's one other thing that happens. Let me warn you, and this may or may not be relevant, but just know it. If I delay enrollment into the Medicare system, beyond this cycle. And we're going to talk about that in a second, the ability to delay enrollment beyond the initial enrollment period. One of the things that does happen, pretty much standard, is when you are enrolled finally in Medicare, the basic components of Part A and Part B. The Part B is based on when you're in the process of enrolling within the prospective period. But the Part A portion is often retroed back to when you were initially eligible or 6 months in time, whichever is the more immediate. So if I turned 65 years ago and now I'm finally enrolling in Medicare, my Part B will be based on when I'm prospectively enrolling, but my Part A could actually be 6 months earlier than that. Or if I've just turned 65 in the past few months, not quite 6 months past 65, I could still find that my Medicare Part A start time was still retro back to the point that I did turn 65. In either case, this may be irrelevant to the individual, or it could have repercussions based on the individual's other kinds of insurance coverage and the ordering and coordination of those coverages. So at least be aware. Now, when the person is enrolling based on their initial enrollment period, based on turning 65, based on having to initiate the application on their own, there's 3 ways to do it. They can go to a local Social Security office, and they can go online to find out where their localist Social Security office is, the office hours, and the contact information for that office. They can use that www address, or they can simply Google Social Security in their zip code or Social Security Administration in their town or city, and up will pop a list of the various offices, addresses, contact information. For the longest time, that was the preferred method of enrolling. Individuals would go to their local office. They would sit down with an enrolling representative of the Social Security Administration or Railroad Retirement. They would spend about 30 minutes or so going through the process. And when it was done, they had an expectation that within a couple weeks, they'd receive their enrollment information. They'd receive their Medicare card. They'd receive whatever other paperwork they were going to be getting. Even before the pandemic, this was starting to be replaced by other means of process. The Social Security Administration in particular was encouraging people to enroll online at their website, or if necessary, call in their application. And so the other 2 methods, even before the pandemic, that were becoming more and more common, especially online enrollment, with individuals going to www.ssa.gov and then looking for the drop-down menu on the homepage for enrolling in Medicare. When the pandemic was in full blossom and Social Security Administration offices and railroad retirement offices, presumably also, were limited in staff and limited in performance, it was not uncommon for the offices to take no walk-in traffic. And the only way individuals could enroll in Medicare was by going online or calling in. Now, these are still valid options. Now, the phone in is probably the least efficient. If you do that, and you can call the local Social Security office number or the general Social Security number and indicate that the reason you're calling is to set up an appointment to enroll in Medicare, the person taking the call will tell you that here are your available dates and which one do you want, and that someone from the Social Security Administration would be contacting you at that point. Do not expect that when you call either the local Social Security office's number or the general number, that the person you're going to talk to will enroll you. It's possible, but it's unlikely. In fact, it's likely that even when you go to a local Social Security office now, even though now officially the pandemic is in waning, that you're going to be told that the staff at that Social Security office is still not doing functions like enrolling people immediately directly into the Medicare system. And that the best they can hope for, if they're not prepared to do this online, is that someone from the office will call them, and here are the available dates and times. Which one would you like? So I've had clients that make the effort to go to the local Social Security office, get there, and are told that because of various reasons, they're not going to do the application with them. But someone will contact them at some point. And here are the times and dates. Let's pick one. And the enrollment process. And this also goes for enrolling in Social Security benefits as well. The process is going to be done over the phone with someone representing the Social Security Administration. So probably right now, the most dependable, efficient way is to do it online. It's to go to ssa.gov and look for the Enroll in Medicare dropdown and complete the process that way. So if the individual is in their initial enrollment period, if they anticipate that, yes, they're going to enroll in Medicare, in fact, both Medicare A and B, and they go to the Social Security website and they look for the dropdown that says apply for Medicare only, they'll complete the application typically in about 15 minutes, even less. It's a basic application to do. Once they've completed it and hit submit, they'll see a receipt on the screen that shows the information that they've completed. I'd recommend printing it, keeping it for your records. And just as important, probably more important, they're going to get a confirmation number. Again, either write that down or take a screenshot. You may have to use that. Let's hope not, but just in case, to check on the status of your application if things are going a little bit longer than expected. Once you've submitted and successfully submitted, the Social Security Administration will review the application. If there's the need for clarification, if something's not exactly complete or correct, they'll contact you, which means it's going to delay the processing, obviously. If everything was done correctly, submitted properly, then it takes about 2 to 4 weeks, really now closer to the 2 weeks. You can expect that the process of the application will be completed. You receive a letter, again, within about 2-ish weeks from the successful submitting of your electronic application. And that letter will tell you, congratulations, your application has been completed. You are entering Medicare the proper date. Either in that packet or shortly after that, you're going to receive your Medicare red, white, and blue card. And shortly after that, you're going to receive another letter indicating that now that you're enrolling in Medicare Part A and Part B, these are the necessary costs associated with Medicare Part A and Part B. And this is either how you're going to pay it, which is typically it's going to be taken out of your Social Security check if you're already collecting one, or how are you going to pay for your Medicare Part A and Part B if you're not collecting Social Security? And there's going to be options that you can choose and a turnaround portion to notify the system how you're going to do this. But you should anticipate from the time you submit this, and by the way, this can also apply if you're doing this over the phone. Once you've given the information to the representative of Social Security over the telephone, anticipate it's going to take about 2 weeks to process. And within that period, if there's any additional information needed or some problem with the information you provided, you'll be contacted. Assuming not, by the end of the 2-ish week period, you'll be getting a letter of confirmation that you're being enrolled, your card, and any additional information related to the cost of the system. This is how it should work. And when you finally get your card, this is what your card will look like. It will have your name. It will have your unique Medicare ID number. Now, once upon a time, it was your Social Security number, typically. That's been replaced for the past decade with a combination of letters and numbers that are unique to you. And typically, no one remembers their Medicare number. And typically, they have to dig it out when they're using it for any purpose. My recommendation is once you get your Medicare card, make multiple copies of it and put it in strategic places and give it to strategic people. So in case somebody else needs to relay to some provider or some entity what your Medicare number is, they'll be able to find it either in what they've maintained or in some place that you've put it where it can be easily found. In addition to your Medicare ID number, it also indicates the parts of Medicare that you're currently enrolled in. Part A, if you've only selected or been assigned Part A because you're collecting Social Security at this point, or if you've picked up both components, Part A and Part B, it'll show that both components are now enrolled and the dates. So in this case, John Smith enrolled in both Medicare Part A and Part B, March 1st, 2016. As I said before, some people are going to seek to delay enrollment into the Medicare system for various reasons. And typically that reason is going to be that they're currently working or their spouse is currently working. And through that employment, they're covered by an employer health benefit. Now, Medicare recognizes that you can delay enrolling into Medicare and not have an adverse impact as long as you meet the one criteria for postponement. And that's that you are covered by an employer plan. And to be specific, the guarantee that you're not going to face an adverse impact is that you're actively employed or your spouse is actively employed with a large employer. That means 20 or more employees. And through this employment, the individual is covered by the employer's group health insurance. So I'm working. I'm past 65 years old, but I work for a large employer. That employer offers, and I've accepted healthcare coverage. I can pass on Medicare B, certainly, and if I'm not collecting Social Security at the time, I can pass on Part A as well. If my spouse is also now past 65, even though my spouse is not working, my spouse can pass on Medicare B, certainly, if she's covered by the same employer plan, even though she's not working, but she's covered by a large employer's plan based on someone, me in this case, actively being employed. And if she's not collecting Social Security either, and she doesn't have to pick up the Part A of Medicare, she can be completely detached from the Medicare system like I would be. When finally the employer's health coverage comes to an end, whenever that is. Now, we're presuming I'm now past and my spouse is past 65 years old. The exception ends when the employer coverage ends. So possibly, this happens, that the employer will extend the benefit a bit past my actual termination. Usually, if I terminate on the third day of the month, my employer benefit will continue till the last day of that month. Sometimes not. And it's incumbent on the individual that is now past 65, that's been relying on employer coverage, to make sure they've checked this out well before they initiate their termination, if they have control over that. Now, Medicare has extended a grace period, an 8-month period from the termination of the employer health benefit to when you must be in Medicare, lest you suffer negative repercussions. Now, most individuals do not want this gap period. They want a smooth transition from the end of the employer benefit into the Medicare system. And so what I would recommend, the approach I would take in anticipating this delayed enrollment into Medicare using a special enrollment period, would be, if you have the ability to do this, think about your termination of employment about at least 3 months before you're actually going to execute on the termination. You're going to need that time. You're going to need at least a couple months, 3 would be better, to start the process. And if you haven't told your employer, particularly the HR entity of the employer, if they're unaware that you're terminating, you're not going to want to wait till the last couple days or couple weeks before. It's not going to be enough time to execute on what's necessary. And some people have pushed back and said, but if I do this too early, I'm going to have negative repercussions from the employer because they're going to know I'm going to terminate. Except you're also going to have negative repercussions by not starting the transition process soon enough. So you have to balance these two things. And so the ideal situation, if you have control of the termination process, now some people don't. They find out they've been downsized, they've been laid off, they've been terminated in some way, shape, or form well before they have time to take any steps to make the transition, and shortly before they're going to lose their employer health benefit. That's where the 8 months definitely comes in handy. But ideally, if you have control of this situation, you should be anticipating about 3 months before you're going to terminate to start the contact with the employer and inform the employer that you're planning on terminating, when this is going to happen. And you're going to need to anticipate that employer providing you with a particular document. This is why you're going to have to initiate the situation. And so ultimately, at this point, in anticipation of going into Medicare in the foreseeable future, you've reached out to the employer, you've informed it it's going to happen, and not because you're just a nice person and you're being courteous, but because you need a document from that employer. The document is going to verify that from the time you were 65 to whenever your employment terminates and when the employer benefit terminates, you're covered by the employer health benefit. So the Medicare system allows you the exception to postpone entering Medicare based on being covered by an employer's health benefit. But they don't assume just because you say you were that you were. You're going to have to demonstrate that. You're going to have to demonstrate when you finally go to the Medicare system, to Social Security Administration, that you are in fact covered by an employer health benefit during that period between 65 and the final termination of the benefit. And that document, called an L564, is completed by the employer. They present it to you. You will provide it at the time you're applying to enter Medicare as your proof. So if you're applying for Medicare based on a delayed enrollment in that special enrollment period, or even leading up to the termination, so that there's a smooth transition. You're not going to use any part of those 8 months from once it's terminated. You want Medicare to go into effect the first day after your employer benefit's been terminated. So a person that's over 65 that's postponed enrolling in Medicare because they've got an employer health benefit and they've anticipated their termination, they've reached out to the employer, they've got from the employer a completed L564 form. They're now going to submit not only their application to enroll in Medicare, either by paper or electronically, they're going to attach the L564. So this is one of the reasons they're going to need at least some lead-in time. The time that it's going to take for the employer to produce it, and it's really not that hard to produce, and usually it can be done within a short period, but they have to take the initial steps. And then they have to take the steps to arrange to submit those applications. If they would prefer going to a local Social Security office, if they're willing to do it by telephone, they have to anticipate this is going to take a while to complete. If they're going to initiate the application online by going to www.ssa.gov, it's still going to take a while to process. And they should anticipate not just an absolute, oh, it'll be done in 2 weeks, but it may take longer. There may be some issue. There may be something they have to anticipate. And especially if they're submitting their application online, then they also have to anticipate not just getting the L564, but they have to get it in a way they can attach it to an electronic application. Either the employer provides it to them in a PDF format, or they turn the paper L564 into a PDF format that they can attach to the electronic application. So if you go into a local Social Security office and you're enrolling based on delayed enrollment, make sure you bring your L564. And if both you and your spouse are enrolling and you're both past 65, each of you will have your own L564 and bring it with you when you enroll. If you're enrolling online, make sure you have a PDF version of the L564 that you can attach to your application. If you're doing it by telephone, this is where it becomes problematic, because obviously you're not going to be able to hand the L564 over to the agent enrolling you at that time. So you're going to be sending the L564 either by mail or fax separately, and that poses a risk. Is it going to arrive where it's supposed to? Is it going to be seen by the people processing it, or are they going to miss it? Gets misplaced, and they're going to have to reach out to you saying, you know what, we don't have the L564, which is going to delay the process. Now, most people are not going to try to phone in, or at least not desiring to phone in their application, and certainly not going to want to mail or fax in their application material if they can avoid it. And in particular, then, a warning: if your enrollment in Medicare is based on delayed enrollment, you really want to try to avoid an application process which compels you to do this by phone, which means then you're going to have to separately submit the L564. Now, it can be worked around. If You go to a local Social Security office and you're told that we're not going to do this at the office, but someone will call you. I'm past 65. I know I got to produce the L564. So what you can do is arrange preemptively that you'll submit the application by phone, and then you're going to bring the L564 and physically present it shortly after the phone to the person who's doing the processing at that local office. Not mailing or faxing, but handing it over. Short of that, if the only alternative you have is to mail or fax, then again, anticipate the potential risk of it not connecting, and therefore, and I would follow up on a regular basis to make sure, did you get it? Do you have it? Is everything okay? So that you're not surprised 2 or 3 or 4 or more weeks later, I'm sorry, we haven't processed because we don't have all the necessary materials, i.e. the L564. So what's the best way to do it other than doing it online and submitting as a PDF version, the L564, being lucky enough to be able to go to a Social Security office, being seen by an individual there at the office, and being able to hand to that person your copy of the L564. Short of that, everything else is less perfect and at somewhat of a risk. If I had to pick the second alternative, I'd do an online app, and I would make sure that I've effectively attached my L564, and I would obviously keep a copy just in case I have to produce it again. Again, this is why you're trying to give yourself as much lead-in time to anticipate all the things that could possibly go wrong, because this is Murphy's Law at its finest. If everything goes well, if the application has been properly submitted, if the necessary documents that have to be attached, i.e. the L564, have been done, if it's been obtained in an efficient amount of time, you can expect that if you started the process 2 or 3 months before your anticipation of entering Medicare, that you will easily and successfully be enrolled in at least the Part A and the Part B. And that's important, not just to have that in place by the entry date for Medicare. If you're going to pick up additional private insurance products, something you're going to need to enroll in those private insurance products that's going to go along with your basic Medicare A and B is that Medicare identification number. And that's going to be from your Medicare card. So I submit my application and I've been told it's successfully submitted. Great. Now I can go and buy something that goes along with Medicare. Well, you can go shopping, but you're not going to be able to complete the enrollment in this private insurance product because the person that's enrolling you, the broker for the insurance company or the independent broker, is going to say at some point, what's your Medicare ID number? I don't have it yet. Well, then I can't submit the application. It's essential. And in fact, depending on the type of product, they won't even start the application if you can't produce your Medicare ID number. So to be able to complete the entire enrollment in Medicare, not just Part A and Part B, but all of the products you're going to want to get to go along with Medicare A and B, you're going to need the Medicare identification number that comes from your Medicare card. And that number is only going to be evident once you have the card. Therefore, the faster you start the application process to anticipate all the bumps and glitches that you may face, successfully completing it, getting the recognition that it's been done, and most importantly, getting the card in the mail, now you can move to the next step, which is actually picking up the additional products. And here again, you can shop ahead of time to at least be efficient, but you're going to need some time to execute on the enrollment. Again, the longer you give yourself to anticipate all the things you need to do in this process, the easier it's going to be. And you created for yourself a time safety net, just in case you need that extra time to work out the glitches and deal with the problems. Yeah, it's possible within less than a month. It's a bit of a horse race to get everything done. And if you really have to do it this way, and some people find that they just know it's not going to be completed. And therefore, they're going to be compelled to use some of that additional time, and they're going to be compelled probably to extend their employer benefit through a process called COBRA. And this is not the desired process. When you're doing this most efficiently, at the point where at the point where the employer benefit ends, Medicare, it's Part A and Part B, and the additional products will start the very next day. And if you anticipate giving yourself enough time, you know the steps necessary. It shouldn't be a problem. In fact, when I'm talking to a client about this, I break it down for them in what I call baby steps. And this is probably a good way to approach this. In this process of going from I'm working to I'm not going to be working, and I expect to be entering Medicare at a certain point, there's several baby steps in this. Even for a person that's going in at age 65, there's several baby steps in this process. The first baby step is if the individual's past 65 and they postpone Medicare, when are you going to terminate your employment, and when is the employer benefit going to be terminated? And this is going to be imperative that you're reaching out to the employer to say, if I'm going to terminate on this date, when does my employer coverage come to an end? And I'm going to need from you the document, the L564. That's baby step number one. When that's complete, when we know what your exit date from the employer plan is, and we have the L564 in hand, baby step number two is now producing the application through the Social Security Administration or Railroad Retirement, deciding whether to do it in the office, over the phone, or online, and submitting the application with the necessary supporting documents. And if you're doing it based on turning 65, it's within the period leading up to your entry in Medicare, effectively submitting your application, confirming that your application has been submitted. That's baby step number two. Now you wait. You wait the time it takes to process the application, keeping your fingers crossed that no boo-boos, and you're notified. Congratulations, we've processed your application. It's going into effect when you presume it's going to go into effect. And where's the card? Where's the card? Here's the card in the mail. I'm enrolled, at least in Part A and Part B. Now comes baby step number three. And you can start baby step number three even before you have the card. You can start shopping for the products, thinking about what else am I going to get to enhance my Medicare A and B. But to execute on that next baby step, you're going to ultimately need the Medicare ID number. When you have that, you're completing the final step. Not just the shopping for and the thinking about the private insurance products, but the executing, the application itself. And not quite done. You're still waiting for the confirmation of the application for the private insurance products. And you know that's complete when you have from each of the insurance companies that you've applied for the private insurance enhancements, you have confirmation that that application has been successfully completed and accepted. And you have in your hands the insurance card from each of the insurance companies. Now you've completed all your baby steps. Now you can expect that on the day that your employer coverage ends or the day you're initially eligible for Medicare. If you're doing this based on turning 65, you're ready. You got it all lined up. It's a smooth, complete transition. This is why this is not as easy as it used to be. This is why the sequence of these baby steps and the completion of them in a timely fashion make this process, under the best of circumstances, a bit of a thing. And if it goes wrong, trying to correct what went wrong and do it in a timely fashion so that we're not delaying entry into Medicare needlessly, becomes a thing also. So the idea of doing this on your own, certainly possible. But many individuals find this whole thing a bit overwhelming. And they're looking for some direction in making sure they're doing it correctly. If they're lucky, they stumble upon a broker that's nice and reasonably friendly and as objective as any broker could be. But if they're relying on the broker to do all of this for them, first of all, they're putting themselves at risk being directed into products that might not necessarily be to their best interest. And they're at risk of when something goes wrong, that broker may not be able to understand what needs to be done to correct it or willing to put in the effort. And there's part of the problem. The process of the broker is to sell a product representing the company that that broker is being paid for by commission to do. And anything beyond the extraneous service of getting the client into a product is just eating into that broker's time and effort and resources. And if I might point out, this is why we exist, PHBSP, to assist individuals in those baby steps, to anticipate making sure everything goes right, but in case it doesn't, what needs to be done to right the ship again and keep it on course, and to represent and advocate for the individual to make sure it's done and not stop and say, well, okay, we're fine, until it really is done, until the person says to me, I have my Medicare card and I've got all the insurance cards from all of the companies that I've applied to. It's okay. Baby steps done. Welcome to Medicare. Congratulations. Job complete. This is the process. This is the mechanics, which used to be, I stop in at a Social Security office, I'm turning 65, I guess I need to pick up A and B. Okay, that's fine. I'm good. The end. Those days are gone. Here's some things to consider. A person that's covered by a large employer benefit, as long as they're not collecting Social Security or railroad retirement benefits, can pass on both Part A and Part B. They don't have to. If they want to, they could enroll in Medicare A or B or both. Now, the employer coverage is going to be their primary. For a large employer, in the ordering, in the coordination of coverage, the Medicare benefit is secondary. It will essentially supplement the employer-provided benefit. And some people find that taking Part A isn't a bad thing. I mean, typically it's not going to have a premium cost, so what's wrong with having some extra benefit? And there's nothing inherently wrong with it, except in some cases, having any part of Medicare could be a detriment. I'll show you in a minute. Keep in mind, though, if you're already collecting Social Security, even if you have an employer health benefit, even if with a large employer, you cannot turn down the Part A. You're going to be compelled to take the A. You can pass on Part B, but A, you're going to receive. And you're going to receive it either retroactively based on as far back as Social Security will go, as close to your age 65, or at least 6 months retroactively. Don't forget about that. And if that has a negative impact on your employer coverage, too bad. You elected Social Security. You should know what the repercussions are. And particularly, the manifestation of the problem of having Part A while you're also relying on an employer coverage has to do with a type of employer coverage. Now, generally, having Part A along with a large employer's health benefit doesn't do any or much detriment. And I would recommend, if you do pick up the Part A because you just thought you should, or because you're collecting Social Security at this point, I would minimize the declaration that you have Part A. Here's an example. Woman goes into the hospital through emergency room, is still working at that time, but has Part A along with the employer benefit. And it's a large employer, so the employer benefit is the superior benefit. Goes into the emergency room unconscious. Daughter goes in with mother. Daughter has no idea what mother's coverage is. She's not even sure what insurance looks like. They're rifling through mom's purse, trying to find representation of the insurance because that's the first thing that the hospital wants to know about. More than anything else, what kind of coverage do you have? They find the Medicare card. Oh, mom has Medicare, Part A. And the person that's handling the intake for the hospital is just not aware enough to say, we probably should look for some other things as well. But no, we've got the Medicare card. There we go. I can move on with this process. The problem is, remember, Medicare Part A is secondary to the employer benefit. And so the hospital, God knows why, submits the request for reimbursement to Medicare. Medicare politely says, I don't think so. And the hospital tells the patient's family, mom's still not quite up to dealing with situations, that Medicare is denied. Now, nobody at the hospital billing bothered to follow through with reaching out to Medicare. Why? Their knee-jerk reaction was, oh, Medicare denied, therefore you owe us buttloads of thousands of dollars for the service, or else we're going to turn you over to collection. Families now in crisis mode. Oh my God. And they don't understand what's happened because no one's explained to them what's happened, because no one has taken the steps necessary to figure out. What I would have done is not even mention that the Part A exists unless I can do it in a coordinated way so it's fully understood by the provider that my employer benefit is superior. But that's honestly a more rare situation. This is the situation that you're looking at right now where the problem arises of having any part of Medicare, Part A. So the individual is enrolled and the individual is relying on an employer benefit. And that benefit is a high deductible health plan in conjunction with a health savings account, an HSA. Now, an HSA is a tax-deferred savings account that the individual employee that has access to the HSA can put money into. And sometimes the employer puts money into this HSA account. The money there is tax-deferred. As long as it stays in there, it's non-taxed. And anything it earns is tax-deferred. And individuals that have access to HSA capability can accumulate thousands and over time, tens of thousands of dollars in their HSA accounts if they aggressively contribute or have employers that are aggressively contributing. And if they don't spend the money in the account, it doesn't go away. It just rolls over. It continues, and it continues to earn money. And as long as it stays in the account, it's not taken out to be spent. It stays tax deferred. Now, at some point, if the money is taken out to spend on qualified medical expenses, then those dollars are not subject to tax. Eventually, once the individual reaches age 65 or older, the individual doesn't even have to take it out for medical purposes. The person could take it out to use it for anything they want. Now, if they use it for qualified medical expenses, it's a non-taxable event. That money they took out of their HSA and spent it on qualified medical expenses. And those qualified medical expenses pretty much run the extent of what you could associate with healthcare. The premiums, the co-payments, the deductibles. And that money that they've accumulated is not going to show up as a taxable event in the year they take it out. If they take it out and spend it on something else, other than qualified medical expenses, then it'll be taxed simply as ordinary. But that's what IRAs and 401ks and deferred savings products for employees work anyway. So it's not any worse than they've accumulated money in some other kind of retirement savings account. And better than an IRA or a 401k, they spend it on the specific thing it's supposed to be used for, qualified medical expenses. The money was now tax-free. This is a wonderful device that employers offer. Not all employers do it, but more and more employers are starting to incorporate in their health benefit a high deductible, catastrophic like health coverage, but an aggressive utilization of the health savings account to offset the costs that are burdened by this catastrophic coverage the employer is providing. From the employer standpoint, the cost of this coverage is relatively low because it has minimal coverage, and the administrative services aren't as extensive as a more comprehensive. And they can pass on that savings by telling their employees, look, this plan is going to have a big deductible, an amount that you have to meet before the plan kicks in. But I'm going to contribute to your HSA account enough money that offsets that deductible, or a large part of that. And you can also contribute yourself. And if you don't have a health event that year that requires dipping into it, that money's accumulated, its earnings accumulate, and you can use it not just while you're employed, but later when you leave, that money goes with you. And that money can be used, let's say, when you're in Medicare now to help offset the expenses related to Medicare. And if you pass away and never touch the money or touch only some of the money, you can name a beneficiary and that person will receive it. Now, at that point, it becomes an ordinary tax event. But so would an IRA or a 401k. So it's not necessarily a negative implication. It works well, except you're eligible to contribute to an HSA only if you're not covered by Medicare and If you enter Medicare, and this is any part of Medicare, even just Part A, you're denied the continuation of contributing to your HSA account from that point forward. And remember what I said. If you finally enter Medicare, even just the Part A, because you now started collecting your Social Security and you're well past 65, Social Security Administration is going to retroactively apply your Part A to at least up to 6 months, which means that you may have been contributing to the HSA incorrectly because you didn't anticipate that now that you're in Medicare Part A, but it's applied 6 months prior, you were contributing during that period. And now you've got an excess contribution to your HSA, which you have to correct. Again, a strategic decision that people have to make if they are working past age 65. If they are covered by an employer plan that utilizes the HSA account as part of the process, and now they start thinking about collecting Social Security benefits. Oh my, which is more important? Because if I collect Social Security, I'm also going to get Part A, which is going to disrupt my HSA account contribution capability. The money there I get to keep. I just can't put more money in. So which is more important? The ability to still robustly contribute to the HSA or the getting of the Social Security benefits? There's no right or wrong answer. There's simply understanding what the impact is and making the decision based on that. Here's some other considerations that are important in this delayed enrollment. It's understanding what counts as employer coverage. Now, individuals that stop working and had an employer benefit while they were working continue that employer benefit by a function called COBRA. COBRA stands for Consolidated Omnibus Budget Reconciliation Act of 1985. It was a piece of legislation, omnibus meaning there was a lot of stuff in this legislation. But the particular thing for this point is that the COBRA legislation mandated that for larger employers, again, 20 or more employees, that there would be a continuation of the employer benefit even after the termination of employment for a period of time, normally 18 months, although it could be longer in certain situations. It's for the employee and the covered family members of the employee. And the employee has to be notified they have the right to choose to COBRA the benefit, and the employer has to facilitate making that so within a reasonable time period. You don't have to do the entire 18 months. You can do some portion, and that may come in handy if, surprise, you've been terminated. It's like, I don't have time to get all this stuff together to take all the baby steps to transition into Medicare. Well, not our problem. You may have to COBRA. You don't have to use all 18 months, but you may need to COBRA a few months to get your paperwork together. Or for whatever reason, you love your employer benefit so much that even after you terminated, you would really like to hold on to that for various reasons rather than Medicare. Could happen, particularly because of the way the employer benefit covers your prescription medication, better than any way Medicare is going to cover your prescription medication. And you could save thousands, maybe even more, by using the employer plan versus Medicare. And so you think, well, maybe I could COBRA my employer benefit for that 18 months at least, and then I'll worry about it. Keep in mind, COBRA, a COBRA benefit, is not recognized by Medicare as an employer coverage. It used to be employer coverage, but used to be doesn't count. So when the employer coverage ends and you elect to COBRA it, Remember that 8-month grace period. It's ticking. And you can do whatever you want in that 8 months, COBRA certainly, but you've got 8 months, not 18 months. And when the 8 months are up, you're either in Medicare or you're facing the possibility of a penalty for not being in Medicare, not meeting the qualifications for the delayed enrollment. Or an individual is approaching age 65. And rather than being covered by an employer plan, they're already terminated even before they reach 65, but they're on COBRA. At that point, they don't meet the exception. The exception for postponing is at the time you're eligible. You're covered by an employer plan. Well, I'm covered by my used to be employer's plan through COBRA. It doesn't count. And if at the time you are eligible for Medicare, turning 65 or even based on disability, if you are not covered by an employer coverage of some kind, either through your employment or your spouse's employment, if you're covered by COBRA or some other post-employment health benefit provided by a former employer, some kind of non-COBRA continuation of health benefits, like some kind of golden parachute package or buyout benefit, none of those are going to constitute employer coverage. And if you utilize those benefits past 65 and even past an acceptable delayed enrollment period, then you're facing the repercussions of not meeting the criteria to postpone entry and meeting the criteria that sets you up for a penalty. And in addition, individuals that are reaching 65, reaching their initial eligibility for Medicare, and at that point, they're employed, but they're self-employed. They're an independent contractor. And the health coverage they have is not an employer benefit. It's simply private insurance they went out in the marketplace and bought. That's not employer coverage either. Well, I'm employed, yes, but the benefit that you have has to be through an employer benefit program. You just got private insurance. That's not going to count either. And again, if you're turning 65, if you don't enroll in Medicare within that initial enrollment period, you're going to be subject ultimately to penalties for not enrolling in a timely fashion or having a valid exception. So keep in mind, if at the time you're eligible for Medicare, you have some benefit that's not recognized as an employer health benefit, a COBRA benefit, a post-employment health benefit that's not based on employer health coverage, or some kind of private insurance product you purchased on your own. None of those will be recognized as employer coverage, or if later you've been working past 65, you were covered by an employer benefit, when you finally terminate that employer benefit, and now you have 8 months to get from that benefit into Medicare, COBRAing or a post-employer benefit or private insurance is not going to extend that 8-month period. And as a result, many individuals anticipating that one of these kinds of products would work to expand the delay or initiate the delayed capability are unfortunately informed after the fact that it didn't work. It doesn't work. And they are, in fact, facing a penalty for not having enrolled in Medicare in a timely fashion. There's another consideration. We've been talking about postponing entry into Medicare based on being covered by an employer plan. What happens when you're working for a small employer? Fewer than 20 employees. And you're an employee of that entity, and your spouse is also covered by that entity. And now you or the spouse or both of you reach 65. Now, if this was a large employer, 20 or more employees, and the entity would be, well, you can postpone and ultimately no problem. But with a small employer, there's no guarantee. And this is why when I said the guarantee that you're not going to face a negative implication is by being covered by a large employer's health benefit. If it's by a small employer, you absolutely need to reach out to the small employer before you're turning 65, because there's two possibilities that could occur, and you're not going to know. Hell, the employer's not going to know for sure. This is going to be a sit down with the insurance being provided with a reputable, competent person who's going to explain what the impact of this is. Or you can just say, you know what, I'm not going to take the risk. I'm just going to go into Medicare. Here is what could happen. Possibly, the employer coverage could continue unaffected. It sometimes occurs that benefits provided by a small employer can act much the same way as benefits provided by a large employer. One exception, but as far as continuing allowed without the necessity to enroll in any parts of Medicare, Part A or Part B, it could happen, but you won't know until you find out. And although there's no requirement to enroll in Part A and Part B, if they do enroll in Part A and Part B, it effectively terminates the employer benefit. So you may be able to maintain the employer benefit even with a small employer past turning 65. No requirement to pick up A or B. But if you do either the A or the B, you've effectively terminated the employer benefit immediately. And this has to do with that person that's collecting Social Security already and is informed that they're going to get their Part A, or eventually starts collecting Social Security. It's going to effectively terminate the employer benefit. So you know what? Not only picking up Part A, you may as well pick up Part B and everything else, because you've just termed yourself out of that employer's coverage. It's more important in the initial stages, especially if you're not collecting Social Security, to know that you might be able to continue that benefit if it's a good benefit, even though it's a small employer. But there's no guarantee, like with a large employer. With a large employer, you are guaranteed that it will continue, and you're guaranteed that that's going to be your primary benefit. The other possibility, the employer may tell you, a small employer may tell you, no, you need to enroll in Part A and Part B. The best you can anticipate from the employer benefit, once you reach eligibility for Medicare, it's going to drop to a secondary benefit. And that's whether you get Part A or not, or Part A or Part B. We will automatically become less of a benefit to you. And therefore, you may as well pick up Part A and Part B, because the only expectation you have from our small employer provided benefit is being a secondary supplement to Medicare A and B. And you may find, nah, not for the cost of this. If I'm going to have to pick up Part A and Part B, I may as well just completely go into Medicare and pick up the additional products. So two things could happen. And the uncertainty of this goes beyond the expectation of what a large employer offers. Your benefit could stay unaffected, but keep in mind, any entry into Medicare at all automatically terminates the benefit. Or it will be effective immediately. It will not remain as your primary benefit. It will drop automatically to a secondary benefit. And even if you don't get Medicare A and B, it will still reduce the coverage to a point where you may as well be in Medicare A and B. And you won't know until either you ask the employer and get a comprehensive and dependable answer, or you find out after the fact when you're submitting a request for reimbursement through the insurance coverage that doesn't exist anymore or exists in a reduced way. That is not the time you want to find out how your small employer benefit works. So large employers, employees of large employers have a certain expectation and confidence in the way things are going to work. Employees of small employers, it's a big mystery. And thus, either you blindly go in with faith that everything will be fine, which is not a good strategy, or you find out. And based on the information you're provided, assuming that this is reliable information, you now make your choices of how you're going to interact and intersect with Medicare based on. And ultimately, finally, if you've now reached the point where you can enter Medicare, didn't pass your initial enrollment period, and do not have the exception of delaying enrollment because you were covered by an employer plan. It could be you've simply chosen not to pick up Medicare for some reason. It could be you thought covering your benefit would be an exception and you find out otherwise. It could be that you've lost a benefit and were unable to transition into Medicare within an appropriate time. There is still one final way that you can enter Medicare. If no other exception applies and you are past your initial enrollment, you can enter the Medicare system every year during general enrollment. That occurs between the months of January and March. You can reach out in the same way you would through your normal enrollment process to the Social Security Administration or Railroad Retirement. You submit your application the same way. The only difference is it's now going to be based on a general enrollment eligibility, and your Medicare enrollment will take place the first day of the following month you submitted your application. So if I'm enrolling based on general enrollment and I can't do it in any other month except January, February, March, it's now January 3rd, the Social Security office is open. I go in and I say, I want to enroll in Medicare A and B. Great, we'll take your application. When's it going into effect? February 1st. If I wait till February 8th, when's it going into effect? March 1st. If I go in March 17th, when's it going into effect? April 1st. Whichever month I'm submitting in the January, February, or March cycle, I will expect my Medicare A and B to go into effect the first day of whatever the next month is in that cycle. So it could be February, March, or April. But I'm also going to be potentially assessed a penalty if in the look back from the time I should have entered Medicare but didn't, if that length of time between when I should have and when I finally do is in excess of 12 months, for each 12-month cycle that I could have, should have, would have, but didn't, I'm going to be assessed a 10% penalty. So if it was 38 months from the time I could have to the time I actually did, 12 into 38 is 3. So there are 3 12-month cycles. And that means for each 12-month cycle, I'm assessed a permanent, lifetime, cumulative 10% penalty. So 3 12-month cycles, 3 times 10%, I am now for the rest of my life going to be facing a 10% penalty on the cost of my Medicare Part B. Well, the good news for Part A, my Part A has a 0 premium. Whatever percent of 0 is still going to be 0. I'm not going to face a dollar penalty. So this really, as far as the penalty, applies to Part B pretty much exclusively. But still, I've not picked up the A or the B when I should have, and I don't have an exception, I can't just get it anytime. I have to wait till the general enrollment, and I may face a penalty on the cost associated, at least with the Part B. And the cost for Part A and Part B, know that, as I mentioned before, Part A is likely going to be a zero cost, but it's based on the idea that individuals have worked and paid into the Medicare system during their working lifetime. For most individuals, they've worked sufficiently long enough, 10 years, and accumulated enough credit quarters. So every year, divide that into 4 parts, so 4 quarters, 4 credits. And the anticipation is that if in that year I worked and paid into the Medicare system, then I have 4 credits. And if I work now 10 years, multiply the 4 credits by 10, I've got my 40 credits based on working and paying in for 40 quarters. Now, if I don't have the necessary credits, if I have a spouse that does, I can piggyback on my spouse's credits. We can't merge. I've got 30, you've got 20, neither of you have the necessary credits. And if you don't have the necessary quarter credits, then your Part A will have a premium cost. And if you are delayed in entering, it will also have a penalty. So less than 40, but 30 or more. The premium's still pretty nasty, $278 currently for 2023. Less than 30 quarters when you enter Medicare, the premium is over $500, likely the most expensive premium for the products that you would get. Now, that's rehabilitatable. If you don't have the necessary credits when you enter Medicare, you can continue to work, continue to accumulate credits, and at some point eliminate the premium cost. Now, some people, because they didn't work long enough in the system or realize that they weren't contributing to the system, are faced with this. Doesn't mean they can't enter Medicare, and doesn't mean they wouldn't necessarily pick up the Part B of Medicare, but they may pass on the Part A, at least for the time being, until they've reconciled the ability to have their Part A at a zero cost by continuing to work and paying into the system. And for the grandma that had thought her husband was working and paying into the system, it finds out later they've been pretty much working under the table and never paying into the Social Security system or the Medicare system, or at least enough, now finds that not only is it unlikely she's going to get Social Security benefits, but it's also unlikely she's going to have Medicare unless she's prepared to pay the cost. At least that can be rehabilitated. If there's any credits she has under her own circumstances, she can utilize that, and if necessary, rehabilitate it. And the easiest way, the way I've done over and over in these kind of circumstances, is point out that grandma starts babysitting and gets paid for babysitting and reports the babysitting just to get the necessary credits, just so that grandma can have Medicare at a zero cost, at least for the Part A. For some individuals that have a cost for their Part A whose income is so low and there's an immediate necessity for the Part A, we're talking about people in Medicaid. The Medicaid system will step in and, pay that Part A cost if necessary. It's to their benefit. Part B is always going to have a premium cost, whereas A is likely going to be zero. It's guaranteed that your Part B is going to come with a cost. Now, there's going to be at least a base amount. Currently for 2023, it's $164.90. But for wealthier individuals, in addition to that base amount, they can pay what's called an income-related Medicare adjustment amount, an IRMA. And the wealthier that individual is, the larger that IRMA is. And there reaches a point, the IRMA itself is larger than what the base amount, the Medicare Part B premium is. And you can see by this chart for 2023 If the individual's income, if they are a single person, they filed an individual return, and the income is less than $97,000, then they're within the base amount's acceptable range. For a married couple filing a joint return, simply double that, we're looking at $194,000. That's whether or not both are eligible for Medicare. If only one is eligible for Medicare, they're still going to look at the joint return. They look to see if that income, the income they're looking for, is their modified adjusted gross income, if that is above or below the requisite number. Below, they're going to pay the base amount only. Above, they're going to start paying an IRMAA, depending on how much they're above. And by the way, they're not looking at the current return, even the last year's return. They're looking at the return filed 2 years ago. Or if they didn't file a return, the income information that would have been submitted 2 years ago. So for 2023, they're looking at the tax information on hand with the Internal Revenue Service for 2021. And that creates another strategic issue. Individuals 2 years ago may have had a significantly aberrant amount of wealth that's not normal in their circumstances. Or individuals simply 2 years ago were working full time and they were generating a significantly larger amount of income. And thus, when Medicare looks back 2 years ago, they're going to see something that's an anomaly to the current situation, a significantly larger income because of some event or just because their circumstances were different. And the individual entering Medicare is now concerned. It's like, man, this is going to be a Part B premium that's going to be in the $500s of dollars because of circumstances that aren't currently the same. So a couple of things. This is recalculated every year. So the worst that you could face is if this is an aberration, it's an aberration only for the period in which Medicare is looking. So Medicare looks for 2023 at your 2021. Next year, 2024, they're going to look at 2022. So if your income came down in 2022, that 2021 was the only off year or good year, then you're going to suffer a larger cost for Part B only for that period. And by the way, it works in reverse. If down the road you have a really good year, a couple of years from that, it's going to manifest itself in a larger Part B premium. The other thing you can do is ask for a reconsideration. If the year that they're looking at is not typical of your income circumstances prior to that year or post that year, you can indicate. Now, you have to wait until Medicare has informed you of what your Part B premium is going to be for the upcoming year. And they're going to explain to you in their notification that it's more than the normal base amount because of their perception that your income was much higher. And they'll tell you, you have the right to ask for reconsideration. Here's how you do it. You can do that. Now, if this were a decade ago, I'd say, save the effort. You're likely not going to compel them to see your point of view. Now it's the reverse. If you can produce a cogent explanation that the year that they're looking at is not a normal indication of your income, and you can show leading up to that, and more importantly, since that, your income has come down, you have a good likelihood that they're going to reconsider and reduce your IRMAA or eliminate it altogether based on your information. Now, it may take a while to submit that. This is not a high priority for the Social Security Administration or Medicare to contemplate. They're going to focus on other things. And it might mean that you're going to pay the escalated amount for a month or two till they get the reconciliation determined. It's just something you're going to have to put up with. They're giving you the benefit of this, and you may not like it, but they're controlling the process. And yeah, you can request certainly that additional amount they took out in the years while they were, in the months rather, while they were still processing your reconsideration be returned to you. And it generally is. But if you reach a point where you're now in Medicare, you have your Part B, and it's based on a calculation that's making you pay a larger IRMAA, and yeah, you've submitted a request for reconsideration to get it down to a smaller amount, but they haven't finished the reconsideration, you're going to have a larger amount taken from either your Social Security, if that's how you're paying for it, or you're going to have to pony up the larger amount to hold on to your Part B until the reconsideration is finalized and you've been informed that you're now going to pay a smaller amount, to which you then request, oh, please, can I have the money you've already taken back? And probably you'll get it, but don't hold your breath on how long it's going to take. By the way, an IRMA is not only assigned to Part B premiums, it's also assigned to your prescription drug coverage Part D amount. So in addition to whatever the premium is for being enrolled in a Part D plan, if your income for that year is calculated as being above the magic numbers, you're going to pay, in addition to whatever your Part D premium is, even if it's a zero premium, some IRMA amount. Now, not nearly as large as the IRMA amounts assigned under Part B, but nevertheless, and in the letter that notifies you of the implementation of the IRMA for the upcoming year, it's going to indicate two things. One, that because your income is over a certain amount, you're facing an IRMA, an income-related Medicare adjustment amount for your Part B premium that can be anywhere from about $66 all the way up to over $395. And in addition, you're also facing an income-related Medicare adjustment amount assigned to your Part D premium. Now, by the way, you do not try to pay the IRMA to the Part D insurance company. They're not designed to accept it. The amount of IRMA that you have to pay for your Part B, B for banana, Part D, D for drugs, that's going to be submitted either by having it taken from your Social Security check, if you're collecting Social Security at the time, or arranging to pay it separately to the Medicare system. And this is not going to be elemental to the insurance companies. It's not part of their process. And again, if you can reconcile a reduction of the IRMA, not only will it reduce your Part B premium, will also eliminate or reduce the IRMA assigned to your Part D premium as well. And finally, once you completed the application, once you've gotten to the point that now your Medicare A and B are in place, anticipate the characteristic of Medicare that it is going to impose on you cost sharing. There will be deductibles and co-payments and co-insurances associated with the basic Medicare coverage. And as a result, a key characteristic of you going into the Medicare system is absolute reliance, or at least anticipating, looking at utilizing private insurance to offset the costs that are imposed on you by basic Medicare. Some individuals entering Medicare have the expectation that there is a post-employer benefit. Now, it's not going to replace relying on Medicare A and B. In fact, it's going to require that you enroll in Medicare A and B. But this employer benefit, this post-employer benefit, is going to work as an enhancement to your Medicare A and B. A good example are individuals that work for public school systems. Their employer, the school district or the state education system, is going to provide them a benefit that will work in tandem with Medicare A and B. Now, it's through private insurance providers, but it is a benefit that only those employees of the school district or the school system have access to. And they can be quite good. And they can be better than anything they could find by going out in the marketplace and shopping for. But it is going to require that to be able to utilize them once they're eligible for Medicare, they have to be enrolled in Medicare A and B, unless they're still working past 65, and now it's not a retirement benefit, it's an employment benefit. Some individuals are dual benefit eligible. They're eligible not just for Medicare, but for Medicaid as well. And those individuals are going to utilize the Medicaid benefit. And in Pennsylvania, that means private insurance representing Medicaid to enhance their Medicare A and B. So rather than an employer retirement benefit, they're going to rely on the state's benefit of Medicaid to work with their Medicare A and B. But by far, most individuals going into Medicare, most individuals in Medicare are going to enhance their Medicare A and B with private insurance directly obtained by themselves by going out into the marketplace and shopping for the products that are going to supplement Medicare A and B or replace the utilization of Medicare A and B and offer them help with the cost of their prescription medications. And all the private insurance products that exist under the Medicare umbrella can be assigned to one of three categories. Anything you can envision that you're going to purchase by being in Medicare is either going to fit into the category of being a supplement to Medicare A and B. In this case, the person is enrolled in Medicare A and B, and they're using Medicare A and B as their primary coverage. They can go to any healthcare provider anywhere in America that agrees to accept. There's no real network other than the network of providers that are willing to work with Medicare assignments. And when they accept a Medicare assignment, when they accept you as a Medicare patient, they're required to also accept any Medicare supplement that you produce, whether it's an employer-provided base benefit or something you purchased on your own, a Medigap. As an alternative to purchasing a supplement to Medicare A and B, you can purchase a Part C Advantage plan. Now, most people understand and recognize them far more than the combination of Medicare A and B and a supplement. They're used to, when they're working, being covered by an HMO, a health maintenance organization, or a PPO, preferred provider organization type insurance. In either case, it's managed care. That means these products have networks. HMOs have an absolute network that if you stray out of the network, except for an emergency, you pay the full price of the cost of the care. PPOs will help with some of the cost, but not nearly as well as if you stay in network, thus compelling you to stay within the PPO's network. The cost for these Advantage plans is typically less than the cost for supplements. It's very probable that you'll be able to find Medicare Advantage plans as low as zero premium. And these products are adequate, not necessarily as good as Medigaps. They have limitations, but one of the advantages of having a zero premium is saving the cost of what you would have spent on a Medigap, perhaps $100 or more on a Medigap. And Advantage plans can incorporate things that basic Medicare doesn't. Now, if you go with Medicare A and B as a supplement, then the things that Medicare A and B don't cover, like basic dental, basic vision, costs for hearing aids, these things a Medigap is also not going to cover, or any kind of supplement. But Advantage plans can offer beyond the Medicare umbrella. They can offer extraneous things like basic dental, basic vision, help with the cost of hearing aids. They can offer things that are even outside the range of healthcare, like access to health club membership, or concierge services, or the ability to pay for over-the-counter products. Lots of different things are added to the Advantage plan process. And some of them are desired by the individual. Some of them are just extensive swag that really doesn't serve much purpose other than to be an enticement for them to go with the Advantage plan rather than the supplement. And this is where the complexity really rears its ugly head. It's hard enough just getting through the baby steps to get into Medicare A and B. Now is the problem of, okay, what direction am I going to go with my private insurance enhancements to Medicare? Do I supplement A and B? Or do I essentially replace Medicare A and B with an Advantage? Because if I enroll in an Advantage plan, I don't get to use my Part A or B. I have to be enrolled in it. I have to pay the Part B premium to be sure, but I don't get the value of relying on A and B to cover anything. It's exclusively in the range of the Advantage plans. And in addition, whether I have a supplement or an Advantage plan, I also have to pick up prescription drug coverage, a Part D plan. So I'm going to get either from box 1 and box 3, a supplement and a Part D plan, or box 2, an Advantage plan that incorporates prescription drug coverage. I can't get 1 and 2, but I can certainly get 1 and 3 or 2 and 3. And ultimately, this is the model that I'm going to face as I'm building my strategy. And in the next Lunch and Learn sequences that we do for the months of April, May, June, we're going to be talking about these alternative products, the supplements and Medigaps, and the Medicare Advantage plans and Part D coverage. But ultimately, the person entering Medicare has to make some big, hard decisions right from the start. Are they going to go with option 1? Are they going to enroll in Medicare A and B, pay the cost for being in Medicare A and B, and supplement it with a private insurance supplement and pay the cost of the premium for that, and pick up a standalone Part D plan and pay the cost for the premium for that? And if they want the things that Medicare doesn't cover, like basic dental, basic vision, help with the cost of hearing aids, and all the other things that aren't under the Medicare umbrella, they're going to pay the premium cost for those things or the enrollment fees for those things. And thus they're looking at costs that probably are going to be in the neighborhood of $300 to $400 a month for this kind of comprehensive. And if their Part B is in excess of the base amount because of an IRMA, then it's not even $300 or $400. It could be $500, $600, multiple hundreds of dollars driven by the IRMA for the Part B alone. Option 2 is an alternative. You're still required to have Medicare Part A and Part B. You're still required to pay whatever the Part A or Part B premium is, including the IRMA, but you're not going to use Medicare A or B. Instead, you're going to rely exclusively on your Medicare Advantage plan, your Part C plan, your HMO or PPO. It's going to be the driver of your coverage. It's going to be the definer of your coverage. It's going to dictate who you can go to, the kinds of services you get, and it's always going to pay less than the expectation of what Medicare A and B and a good supplement. Likely, any Advantage plan is going to offer you less coverage in terms of medical things than Medicare A and B and a supplement would. But they offset that with lower premiums and the non-Medicare kinds of services that option 1 can't offer. And the choice that an individual makes, whether to go with 1 or 2, is imperative in the initial start, because it may be difficult or impossible to swap from option 2 to option 1 at a later time, or the costs representative from swapping from one to the other may make it economically preclusive, or simply by making a bad choice in whatever they do, it represents an ineffective strategy for their needs. And here again is the problem. Who do they turn to? They can give them objective, unbiased information. How are they going to absorb what they need to know? How are they going to wrap their heads around the process, which makes it even more frustrating and more risky if they're going in with an assumption that I'll just pick something and then I guess it'll work. Often it works well enough. It gets them through the process. But usually, it's not necessarily the best. And often, not only could something better be obtained with the effort, something significantly better. And not just minor savings, but significant and access to better services. And this is what we're going to look at in the next few months this year. But for today, we reached the point where you have an idea of what the steps to get into and the overall strategy of anticipating. So we'll leave it at this point. Thank you so much for watching this presentation. I hope you enjoyed it, and I hope you learned something. If you would like to know more about our program and the other presentations that we've created on various healthcare-related topics, please visit our website at phbsp.org, or you can call us at 412-266-8322. Either way, I hope to hear from you. And as always, be safe, be healthy. I'll see you later.